and we're interns here at the Cardiovascular Wellness Program. Our presentation today is on stress and mindfulness interventions, and we'll get going into it. Just a little overview of what we will be going on today is what is stress, the types of perceived stress, leading causes of stress, how stress affects the body as we age, and what are mindfulness practices, the benefits of mindfulness interventions, and also examples of what mindfulness interventions are. Okay, so what is stress? Okay. Um, so according to Leah Heaston, I'm using her definition of what stress is. Stress is a normal physical and emotional reaction or response to the ever-increasing demands of life, including change. Stress can come from any event or thought that makes you feel intense emotion. Um, and- yes. Um, there are two types of stress, and I just want to note that the two types of stress that I'm referring to are not the are different than what people normally think of as the two types of stress, which are acute and chronic stress. These are just the two types of perceived stress that we as individuals will experience. Um, the first one is positive stress. Positive stress is a beneficial stress response that motivates you to achieve goals and can improve your performance by providing a sense of challenge and excitement. So examples of this are like a new job, retirement, wedding, or birth, or even this morning I had a performance and it was really exciting. I'm in theater and I had like good stress because I'm like, I want to perform really well. I hope that I get to show everyone what I've been like preparing for, you know? And then there's also negative stress, which is bad stress or distress, which is a harmful stress response that occurs when you feel overwhelmed by demands, leading to anxiety and decreased performance. Essentially, negative stress wears you out, leaving you feeling jittery. This stress is the one that is very harmful to your health and is most commonly associated with chronic stress. And some examples of this are like having a high demanding job that tells you to work hour after hour without having any overtime pay, having financial difficulty, death of a loved one, or even like relationship strain. Bye bye. Okay. And then, yeah. Oh, sorry. How do I go back? Wait, I don't know how to go back.
Maybe just use
All right,
this.
here.
There, just
Okay.
use these.
Okay. I thought I put a transition. But overall, our perception of stress determines how we view an event and the way in which we choose to respond to it. On occasion, stress can actually be beneficial. It can challenge and motivate us, increasing our ability to be more resilient. So now I will take a closer look on how stress is inside of our bodies, which is in the autonomic nervous system. Oh, I can't see it. Hmm. Well, it says autonomic nervous system in the top. But the autonomic nervous system plays a crucial role in the stress response primarily through the sympathetic division of the nervous system. So on the left side we have the parasympathetic division, which activates our relaxation response, and on the right is our sympathetic division, which activates the fight or flight response. So mm, yeah, in the sympathetic nervous system, the flight or fight response is activated when we encounter a stressful situation, leading to physical changes in our body, including your increased heart rate, blood pressure, and breathing to prepare the body for any type of action. Meanwhile, the parasympathetic division aims to restore the body to a calm state once the stressor event has passed. And mild stress can even stimulate the sympathetic nervous system as well. The next one, what are the leading causes of stress among older adults? So one thing that the senior community has in their favor is that they have lived. You all have undoubtedly gone through many different forms of stress and change in your lifetime, most likely having developed resilience, which is the ability to bounce back from difficult situations. However, there are challenges that few have faced that the rest of us may not have had to deal with, which are isolation, living on a fixed income, the inability to afford daily medications, experiencing cognitive, functional, and sensory impairments, dealing with one or more chronic health conditions, pain, and complicated diagnoses, coping with a loss either by like retirement, financial independence, loved ones, and just the ability to carry out everyday tasks. These are more in the spectrum of bad stress and can cause serious issues on both your mental health and physical health. So now, how does stress affect the body as we get older? Um, for seniors, stress often manifests itself in more physical ways, including health problems. So, some warning signs of stress include frequent headaches, sleep problems, fatigue, difficulty concentrating, change in appetite, muscle tension, pain, chest pain, upset stomach, and more. If someone already has chronic health conditions, it may mask these common symptoms of stress and associate them with the chronic disorder that they have. Additionally, chronic stress can also lead to more severe health problems like heart disease, high blood pressure, and diabetes. Those living in a constant state of stress are also prone to illnesses like a cold or flu. And due to stress in the body, vaccines tend to also be less effective as well. Mm. So some other effectors of stress, I already listed high blood pressure, high blood sugar. It can clog the coronary arteries, and increase the chance of having a heart attack. Can lead to depression, anxiety, weight gain, a weakened immune system, digestive issues, including um, primarily like ulcers, um, headaches and worsen chronic pain, cognitive impairment, sexual problems. It can also cause environmental environmental issues like relationship problems, social isolation, developing unhealthy coping habits like unhealthy eating, smoking, alcohol, and poor lifestyle habits like missing important events like with family or having like regular medical checkups and not taking medications as prescribed. So, um, for the past few weeks, me and Destiny had made a survey and we have been collecting responses regarding stress and relaxation. This is out of the 14 responses that we have taken, everyone has little to no stress, which is very good. We don't want anyone to have bad stress. But yeah, even if you do, that's all right. It's a natural occurrence, whether big or small, but that's where we'll be alluding to in just a little bit. And now we have another result to show. Majority of the people in the program have set aside time for personal hobbies, and I didn't. It's not in here, but a lot of people also have a lot of time to like relax and cool down after a long day, which is also good. It gives you time to take. It gives you time for yourself to relax and let go of your worries or frustrations. And now we will be going over to Destiny for what are mindfulness
What are they doing?
practices.
13. Okay, so I'm going to be talking about mindfulness. So, mindfulness is one of the most popular meditation and mental health practices. Its purpose is to increase your awareness of your thoughts, feelings, and experiences in the present moment without worrying about the past or future. Mindfulness activities can help with dealing with stress, anxiety, depression, and many other mental health concerns. Mindful practices are accessible for people of all ages and backgrounds, and it can be extremely rewarding practice.
Mhm. And some of the benefits of mindfulness.
Yeah.
Yeah. I don't know how to make it small.
Oh.
Oh, thank you. Okay, some benefits of mindfulness practices. Um, uh, It relieves stress, and as we have seen in the previous slides, stress is inevitable and is a common problem for many older adults around the world, even younger folk like us, going into college and stuff. So, as you go through big life changes or experience challenges, you may find yourself feeling tense, worried, or anxious. Chronic stress can lead to serious physical consequences like hypertension and heart disease. So, keeping your stress levels in check is very crucial. Mindfulness practices are a great form of stress relief. Once you become comfortable with the practice, you'll learn how to handle difficult or stressful situations better without having an intense reaction. Mindfulness meditation and breathing exercises, which we'll talk about later, can help you calm down and regulate your nervous system when you experience symptoms like having a racing heartbeat, shortness of breath, or even headaches. And second of all, it improves memory. Memory is a common concern for older adults, but exercising your mind can help to keep your memory sharp. I know we had a presentation sometime before about like puzzles with cognitive activities like for keeping your brain good. That was very bad. But yeah, mindfulness practices assist with strengthening your brain and your memory, especially your working memory, which, if you've taken a psychology class, is your immediate short term memory. Research by Newberg et al. From the Journal of Alzheimer's Disease did research that shows that mindfulness practices can even slow the progression of Alzheimer's disease and dementia. Third one, it strengthens cognition. These practices can strengthen many cognitive processes, including your attention span, alertness, and logical reasoning. A study done by Britta et al. Under an article titled Psychiatry Research has found that mindfulness activities physically change the brain by increasing the volume of gray matter, the areas of the brain that are responsible for learning and memory. So keeping up with any form of these practices help you keep your mind sharp. And lastly, it stabilizes your mood. Mindfulness practices can help with symptoms of depression and other mood disorders, which are unfortunately common in older adults. And even if you don't have a mental health disorder, practicing mindfulness can improve or regulate your mood. Those practices encourage you to focus on the present without ruminating on the past or worrying about the future, which leads to feelings of contentment and peace. And there are many ways to practice mindfulness. In the next slide, I will show you some of the most popular mindfulness activities.
So these are the examples of mindfulness practices. I won't read them all, but as you can see, there's a lot of little ones where mindfulness practices doesn't have to take like an hour or two a day. You can easily do it for 10 minutes, 20 or 30 minutes, or you can do it as soon as you wake up. Like some of the main ones are walking, journaling, positive affirmations to yourself. You can also do breathing exercises when you wake up in the morning to help start off your day. Okay, you can exit.
And then also David, he's not here, but he also does Tai Chi in the mornings at 9 a.m. and that is also considered a mindfulness practice. And then also in the survey, we asked participants if they are currently participating in any of the following practices. And the most common was walking, reading, gardening, and puzzles. We also have a puzzle over there that's still not finished, but hopefully it'll be finished by the end of the semester. um, yeah.
I just set up a coloring table too, by the way.
Oh yeah, the coloring over there.
Okay, so one of the examples was breathing exercises. So there are different forms of breathing exercises you can do. I actually found that out when researching it. But you can do mindful breathing, which is like meditation that's going to help focus your breath. I honestly do that like at least once a week, and I think that's definitely helped me with relieving stress when it comes to college, and then just like obviously the transition just to adulting as well. You can also do deep breathing. So you literally just as soon as you wake up, they recommend doing it in the morning. You just like take deep breaths and then it helps relieve like muscle stiffness too. And then there is something also called box breathing. So it's something where you hold in your breath for 4 counts and then you exhale it for 4 counts and you're sort of visualizing a box, and that's going to help with the rhythm of like your breathing. So there are many different like breathing exercises you could do, which take as little as maybe like 10 minutes that you can just start off your day. And then body awareness. So it allows you to be more in tune with your body. This is just taking time out of your day to relax your mind and also your body. You can do it laying, you can do it sitting down. You can also practice standing meditation, which Linda also does stretching classes, so that can also help as well. It's going to help center and quiet your mind.
And then I just wanted to add this little thing. I listen to this artist called Jhené Aiko, and she strongly encourages meditation even during her concerts. So she sets like 10 minutes to meditate with her audience, and I find that really cool. She has a song called Trigger Protection Mantra, and you can play this once if you want to like do body awareness. I can play a little snippet if you guys want.
That's a link there too, and
I tried to put a link, but I didn't know how. But I'll just play it right here. And then she I forgot it was like a little like ball. And like listening to this while like laying down really helps like relax your mind and be in peace with yourself. That's all. Then yeah.
Mind mapping was also one of the mindfulness practices. So it's an excellent technique for a senior who has a lot of mental stress and worries. This will help break your negative thoughts or emotions into smaller pieces that's preventing you from getting overwhelmed, while also allowing you time to tackle, one step at a time.
but this is. We did our practice on that Sunday.
Mind mapping.
Mind mapping? Yeah, I just found out about it when I was doing research, so.
Map your mind, John. That would be one awesome looking map.
And then guided meditation and positive affirmations were also another example. So guided meditation helps you focus on the present moment and become more aware of your thoughts and feelings. It also helps observe your thoughts and feelings without judging yourself. And then for positive affirmations, it's direct on your focus of positive thoughts and self-worth. Promote a more present and accepting mindset, and then it also helps reduce stress, anxiety, and self-esteem as well.
And you'll find a lot of guided meditations on YouTube if you search it up. They can go from 2 minutes to like 30 minutes, depending on how long you want to do the meditation for. I personally like listening to this musician. She goes by the name of Umi, and she has a website called whoisumi.com, and she has like a lot of like daily things or even night meditations to help you go sleep as well. So, yeah. And
Linda
then
Larson has a lot of stuff posted on her webpage too on her site.
And then these are some examples of positive affirmations that you can repeat to yourself to uplift your spirit wherever. See this little cub? That could be you. Yeah. So some examples of positive affirmations you can tell yourself is like, I am enough, I am whole, I am me, and I can make the changes I want to make. I am worthy. I am worthy of self-care and self-love. I'm grateful. I'm grateful for all I have. I am proud of myself and will continue to strive to do well. And usually when you do positive affirmations, you have to really convince yourself that, yes, I am all of the above. I am what I say I am. So yeah, usually repeating this for like 5-10 times. I know I say these to myself before I go to class whenever I have like a bad day. So yeah. Do you guys want to practice like one of them or as a group? Are you guys fine? Which one would you guys want to do? I am enough. I am worthy. Or I am grateful. Like any specific phrase?
Well, this is something that we should do the grateful.
Grateful. So we will repeat this as a group for 5 times and really convince yourself that, yes, I am grateful. I am grateful for all I have. Okay, ready? Okay, we'll all say it as a group all together. Okay. Okay. 3, 2, 1. I am grateful. I am grateful for all I have. I am grateful. I am grateful for all I have. I am grateful. I am grateful for all I have. I am grateful. I am grateful for all I have. Okay.
Oh, that was
What did I
4.
say? Yeah, that was
Yeah.
4. Sorry, not 5. 4. Yeah. Alright.
Yeah.
Grateful for stopping. Yeah. Yes. Yeah, still grateful. All right.
And then journaling is also one of them. So this is going to help express your thoughts and feelings. It helps identify triggers, practice positive self-talk, coping with trauma, and then set goals. I journal as well. Sometimes I'll go to therapy. If I don't go to therapy, I find journaling a good way to kind of like express your thoughts and feelings. Sometimes I like to journal just because I kind of just want to talk to myself without talking to someone that's biased. So I sort of just want to release all my thoughts and feelings. And then like I obviously have stress triggers as well. So identifying those, I like to write down too if I'm really stressed out one day, like kind of like write out what I'm stressed about. And this helps identify those little triggers where you can go back and be like, maybe I can like take less time stressing about these specific moments. You can show me journal.
Okay, so I brought my journal. I'm just gonna show like the first page, but I also like adding little stickers to help me like, oh, like feel motivated to keep writing because I sometimes I stop when I journal and then I just leave spaces for days that I haven't um like written in, which is not really needed. But I literally just talk about my day, even if like I'm not like stressed or anything. It feels good to like write about like the fun things you did for the day, and you can look back on it and be like, huh, like if like you were sad then, you would be like, oh, I had such a fun day that day. So yeah. All right. Oh, okay. And then the summary. Yeah, stress is a normal physical, mental, and emotional reaction or response to the ever increasing demands of life. Stress often manifests itself in more physical ways for seniors. The leading causes of stress among seniors include financial distress, coping with a loss, etc. And some symptoms of stress include a weakened immune system, high blood pressure, high blood sugar, heart attack, depression, and a good thing that we went over today is that the participants of the program have little to no stress. And then summary part two. Yeah.
And then mindfulness is one of the most popular meditation and mental health practices. Some of the benefits could be relieving stress, improving memory, stabilizing the mood. Some other examples of mindful practices are what we went over, so like breathing exercises, body awareness, mind mapping, and then journaling. So as you can see, like some of these mindfulness practices, they're easy to incorporate in your schedule if you're not already doing it, but I'm sure a lot of people already are, at least maybe they're doing meditation or breathing exercises. But like I said before, they're really great on your health. I do them all the time. So you can even do it for as little as 10 minutes or as long as an hour. It really does not take that much time. And I think it is important to have these little practices just to like do at least like once a day, I would say.
Thank you for listening. Do you guys have any questions or yeah?
As adults, as seniors, we sometimes create our own stress. As an example, my sister is 90, and she has been the center of the family, the center of the church, and all this, and doing everything and capable, and now she's finding she's not able to do. I mean, stresses her out to do some of those things, and so I talked to her the other day, and I said, get a mild sedative.
That's one way, yeah.
But these kinds of things might be helpful for her to, we've been talking about. But we create our own stress by
Yes.
we have expectations that we should be doing things that we were able to do previously, but now can't.
Yeah, I think also as a college student, I create my own stress. I think sometimes I'll like overwork myself or put too much on my plate because I want to do it all, but sometimes you just can't, or I'm too down on myself. Like if I don't get maybe an A on an exam, I still get a B, which is good, but then I'm stressing over that little grade when I'm not recognizing, you know what, I did the best I could, and B is obviously so great. So I think it's also important, like you said, to not really stress yourself out, but also realizing like the things you're able to do right now and what you're also like achieving in time.
I'm curious about the mind mapping. You guys know, like, what is it? I just looked at
So so
It's more like organizing your thoughts, I feel like, because like for me, like I feel like I can be thinking of like 5 different things at once, but I'm not taking it one at a time. Like it's kind of like doing multiple things at once when you're should be taking at a time. Like I would say writing out, like planning your day basically. So it's like writing out what you need to do. Okay, I'm gonna do this today, I'm gonna do this next, or if I don't finish, let's come back to it. So it's more of like organizing your thoughts and everything, just not having a bunch of like random thoughts or
Not
even
so
like,
chaotic.
yeah,
Yeah.
exactly. Yeah.
And then also mind mapping is also very like good to have if you're having a lot of like negative thoughts. You can dissect like, okay, which negative thought am I having? Is it like related to another negative thought I'm having? Like you can see how different things correlate and you can find like the source of the problem of your stress or whatever's happening in your life.
Yeah, it's like identifying the trigger because when I was in therapy, I used to go to therapy. My therapist actually had me write down every time I got stressed out. And then it's basically find that little thing that's setting you off. Like, so I think mind mapping could also help if you're, just going through a tough day. It's even just writing it out and seeing like, why am I going through that? Yeah,
Yeah.
exactly. Hmm.
Yeah. Mm-hmm. Mm-hmm.
We continue to people our idea how to communicate with people. And that help us to understand what the new generation expecting from the new
Hmm.
That's a great
That's a
question.
great question. Yeah.
My personal opinion is they don't have expectations, and that's the beauty of what they learn is because they they don't know. They come in here and they realize, oh, I can talk to an older person. They're just people, aren't they? They don't know that initially.
Mhm.
If you guys' attitudes change about older people once you started coming in here?
No.
I think it's been the same. Like,
Not in a bad way. Not in a positive way. I think I've always, I don't know, really not excited, but no, not in like a bad way. Cause for me, I'm honestly trying to go through the nursing route. So I'm debating on if I want to specialize in neonatal, which is with babies, or gerontology. And that's just something I've always been interested in. So I wouldn't say it changed. I feel like if anything, like coming to this program has like I don't really know how to explain it, but I don't really think my viewpoint as like you said, like we're just all like speaking and talking, communicating with each other. I don't think I view anyone like any differently or because of like age. I don't really think that should be like a factor at all. But I don't know what you were gonna say.
yeah, no, yeah, it hasn't changed at all either. And I have like a lot of like grandparents and stuff. So I'm like, oh, okay, this is normal. I can just talk to them like whatever. And also being in this program, I really like talking to you all because I get to hear like all your different like stories from like when you were younger and even like what you're doing now. So I really appreciate this program for that. Yeah,
Yep.
age is only a number.
Mhm.
Yeah.
Yeah. Is there any more questions? Or
Linda Larson would be very proud of you, so, yeah.
thank you.
Thank
Alright,
you.
thank you. Thank you. How do I see this again?
Mm.
Mia. Hi, Mia.